Thank you for joining the wellness program at Durance Pharmacy. Today we are talking about the basics of cholesterol. Before we begin our discussion, let's cover our Healthy Heart Club basic truths. The American Heart Association defines blood pressure as normal being less than 120/80, prehypertension being 120 to 139 systolic over 80 to 89 diastolic, and hypertension as greater than 140/90. The second part of having a healthy heart is maintaining healthy cholesterol levels. Let's talk about cholesterol goals. Our total cholesterol should be less than 200. The LDL, or lousy cholesterol, should be less than 100. And the HDL, or healthy cholesterol, in men should be greater than 40, and in women greater than 50. Remember, your doctor might have different goals for you depending on other existing medical conditions. Ask your doctor what your specific goals should be. Until then, these goals are a good place to start. Most of us have heard about cholesterol, low cholesterol diets, medicines to lower cholesterol, and the problems associated with elevated cholesterol. Today we will talk about cholesterol, clear up some myths, and discuss ways to lower your cholesterol. Cholesterol is a waxy substance found in the fat cells of blood. We need cholesterol to build healthy cells, but this is where it gets tricky. Our bodies make all the cholesterol we need to stay healthy, and the cholesterol you get from foods is extra. Since it's not needed, it just floats around in the blood and attaches to a protein. This is called a lipoprotein, and eventually it builds up in your vessels. This is when your cholesterol level becomes dangerous to your health. Not all cholesterol is bad. We need some to be healthy. HDL is known as the good cholesterol, and LDL is known as the bad cholesterol. Triglycerides are also bad cholesterol. All of these together make total cholesterol. It is important to know your level for each type so that you can make changes to improve your risk for damage. Total cholesterol is a measure of all the different types of fat in your blood. It is important to know if it is elevated, but it does not tell us much about the specific types of cholesterol. The recommended level is less than 200, but less than 150 is a reasonable goal. Research has shown that lower cholesterol levels mean a lower risk for heart disease, stroke, and peripheral vascular disease. HDL, or high-density lipoprotein, is the good cholesterol. It protects your heart. It takes excessive cholesterol back to the liver to be processed, and this prevents its accumulation inside the blood vessels. HDL should be above 40 in men and 50 in women. In general, a higher HDL means less risk for heart disease. LDL is low-density lipoprotein. This is the bad stuff. It attaches to the inner walls of blood vessels and causes narrowing, hardening, and complete blockage. This is what causes heart disease, heart attacks, strokes, and blood clots. The LDL level recommended for males and females is less than 100 for most individuals. With LDL, lower levels mean more heart protection. VLDL, or very low density lipoprotein, is part of LDL. It has the most triglycerides, makes LDL particles larger, and causes damage sooner than other types of cholesterol. It is the hardest to treat and may require more than one medication along with diet and exercise. If you have a strong family history of heart disease, or if your lifestyle choices put you at greater risk, you should talk to your doctor about VLDL. Triglycerides are tiny fat particles transported in the bloodstream. In the past, this is all we could measure. Today, more specific tests are available. It is still important to monitor your triglyceride level and keep it less than 150 to prevent heart disease. It's hard to remember the names of the test, what your level should be, and when you should be checked. Let's talk about these and maybe clear up some questions that you might have about cholesterol testing. Monitoring of your cholesterol is part of a healthy lifestyle. Cholesterol screenings are quick and easy and provide valuable information to protect you from strokes and heart disease. Since there are no specific symptoms for abnormal cholesterol, blood levels must be checked. You can't wait until you feel like your cholesterol is high. By then, damage is already occurring and your health may be in danger. Most of you have had your cholesterol levels checked by your healthcare provider. If you haven't, start now. It's a good idea to have a baseline test done around the age of 20 years, and then every 5 years after that if the levels are normal. Cholesterol levels begin to rise after the age of 20. If the level is abnormal, your healthcare provider can help you decide how often to be tested. Take into consideration your lifestyle, risk factors, and any other health problems you might have like diabetes or high blood pressure. In the past, the doctor's office or hospital was the only place to have cholesterol testing done. Today, many options exist. For many people, the doctor's office is still the most convenient place to go. If you don't see a doctor regularly, you can have your cholesterol checked at a public screening. Check your mail for flyers, watch the news, or talk to the local health department about screenings. Also, pharmacies and other businesses provide screenings. The American Heart Association can also help you find a place to be checked. Make sure these screenings are done by reputable organizations. Durand's Health Mart Pharmacy offers cholesterol screenings to our patients, even those not involved with the wellness program. Remember to tell your healthcare provider if you are having tests done elsewhere, and always review the results with him or her. One last option is home testing devices. These are now available. Research and testing continues to determine if they are accurate. Also, many kits available don't test all 4 levels. Talk to your healthcare provider before doing a home test. A cholesterol screening should include total cholesterol, LDL, HDL, and triglycerides. Your doctor may want to check for VLDL if you are at high risk for heart disease and stroke. All of these levels together are referred to as a lipid profile or fasting lipid profile. Since the LDL and triglycerides are affected by what you last ate, many healthcare providers want you to fast for at least 9 to 12 hours before your blood is drawn. Make sure to let your provider know if you have not fasted. False high levels can lead to unnecessary treatment and worry. If you have diabetes or are concerned about hypoglycemia or low blood sugar, discuss this with your provider and try to have the test done as early as possible. Make sure to bring a snack to eat after your blood is drawn. Good cholesterol can be raised and bad cholesterol can be lowered by many different things. Some are simple and others are more difficult. Genetic causes can't be altered, but good choices can lower the chances of heart disease and stroke. Lifestyle changes are by far the best way to begin to make your cholesterol levels better. Not only will these changes help your cholesterol, they will also help you avoid serious complications from diabetes, heart disease, vascular disease, and high blood pressure. We will discuss lifestyle modifications more in depth in future videos. Next week's video is Staying Alive. We will discuss the importance of heart attack and stroke prevention. Remember to stop by the pharmacy for a blood pressure check sometime this week. Contact Macon Carroll, pharmacist at Durand's, if you have any questions or need assistance with your medications. Special thanks to David Pope, pharmacist at creativepharmacist.com, for allowing Durden's Pharmacy to use the Healthy Heart Club resources for our wellness program. You are invited to join us at Durden's Pharmacy for our monthly Healthy Heart Club meeting. Bring a friend and join us as we learn about heart health. We meet the second Tuesday of every month at 7 p.m. at the pharmacy. Thank you and have a wonderful week.